Hello everyone, this is Dr. Veena and you're watching my YouTube channel Dr. Veena, your homeopath. Well, today's topic of discussion is about an infectious condition called chickenpox. Stay tuned with the whole video because I'll be explaining about chickenpox, its causes, how it spread, its sign and symptoms, its complication. We'll debunk certain myths related with chickenpox, and finally we'll be explaining about our homeopathic medicine, which includes a preventable medicine too. So let's start. Well friends, chickenpox is an infectious condition which is caused by a virus called varicella-zoster. Well, this is an infectious condition, and especially you must have seen chickenpox are seasonal. Whenever the season changes from very hot weather, rain comes up, rain erupts, so that moment, or very summer starts, at that time when the seasons changes, the virus become very active and becomes infectious. It's very common in community. Well, how it is spread? It is spread by direct contact with someone who is infectious. From there, from if the person is coughing, sneezing, from the droplets, that infectious person can spread this infection. Well, what are these signs and symptoms? Before that, let me tell you about its incubation period. Now, what is incubation period? It is the time interval from the person catching this virus, the pathogen, entering into the body of this person, till the first and sign symptom which this person produces. So that time period where this infection comes, develops, and then ultimately the sign and symptoms. So that period is incubation period. Well, incubation period of chickenpox is around 14 to 16 days. Means 2 weeks, almost 2 weeks it will develop inside the virus, and we will, after that, sign and symptom are appeared. Now, what are the sign and symptom of this chickenpox? Well, in the starting, there may be sore throat. The person may say that I'm not feeling well, headache will be there, or sore throat, as I said, or something which is not good feeling, right? So there it can start, or a fever, it start with a fever, and after this eruptions, the rashes will be there. The rash of chickenpox is actually in 3 stages, 3 phases is there. Now, first phase, the rash will be just small red bumps, and I tell you, the bumps will be on the chest or a trunk area, or 2 or more on the face, and then it will spread to the peripheral area, that is the hands or legs. In that period, basically, it is very difficult to diagnose. It might look like a pimple, it might look like a mosquito bite, and then on the second, third day, it will increase. The crops will come. The second phase of these red bumps will be in terms of vesicles. The fluid will be filled, and completely these eruption will come out on the trunk area, then the peripheral area, and they will just look like raindrops. And this is very important for diagnosis. These chickenpox rashes will be completely like raindrops. So there you can diagnose with other conditions. Then after the vesicles complete its course, then it will dry itself into scabs. So scabs will be formed, these vesicles will burst, and then ultimately burst, or the fluid will be absorbed, and then ultimately it will be dry and scabs will be shedding off. So these are the 3 phases of our chickenpox. Now, chickenpox is normally very mild, especially in small children, teenage kids, but as in adults or immunocompromised persons or in pregnant women, it is little complicated. Now, these rashes not only on the body, but it can happen inside the oral cavities. Then there will be difficulty. It can, on genital area also, there might be few rashes, few eruptions. Then there will be difficulty. Let's see its complication. These complications, if the virus go inside the organs and it affects the brain, it turns into encephalitis. If it affects the the lungs, pneumonia, and if it might secondary infection is added, bacterial infection is added on it, there can be toxic shock syndrome also. these virus might be dormant in the nerves, and for 1 year 2 year nothing, then after that it comes out as in the form of shingles. So in the nerve area there will be clusters of these poxes, these rashes. So shingles can be there in pregnant ladies also, or immunocompromised person. It is advisable they should be, taken proper care, because in immunocompromised person obviously immunity is too low, so obviously this virus will attack them fiercely. Similarly, in pregnant women, if she catches this infection early in the pregnancy or later in the pregnancy, consequences will be there. So this has to be really taken seriously. Now let us see, if you have chickenpox, if someone is having chickenpox, what to do. Well, as I said, chickenpox is an infectious condition, so isolation is one of the most important thing. One has to isolate the infected person. If small kids are there, obviously it is very difficult, but at least don't let the kid go to, playing area, or schools, or where they mingle with the other people, and the other people might again, as a community, it will transfer from one person to another. So isolation is very, very important. Second thing is, this chickenpox can go into complications, so rest and diet is very, very important. So for resting, yes, one should take proper rest and proper diet. In diet, what I'm talking about is simple bland food is enough, because if you take spicy, oily, and fast food and sodas, it might inflame these rashes, and these rashes has to be properly healed. The chickenpox in itself, it will take almost minimum 10 days it will take to heal. So at least 10 days you really need to take care of yourself. So 10 to 14 days, in fact 14 days, 2 weeks, it will take properly to get better. So for that you really need to take proper food and rest. For drinks, yes, hydrate yourself with water, coconut water. You can take fruits like bananas, or you can take apples, but better not to take citrus fruits or citrus juices, because it might inflame these your rashes. So it will take more time to heal. So this is all about the basic diet regime of chickenpox. Now let's see what are the myths related with this chickenpox. My dear friends, chickenpox, I don't know why, but some people, it relate with the goddess wrath as well as goddess blessings also. So my dear friends, this is not at all related with all these things. So please understand, chickenpox, when you have chickenpox, you take rest, you need to take proper diet, otherwise complication can happen. So that is very important. Second very important question or a myth is, like, when you have chickenpox, don't take bath. Well, my dear friends, if you have chicken pox, you can always take bath. There is no problem. But the only thing which you have to see is your rashes, the vesicles, which is fluid filled. It shouldn't be burst. You cannot take and apply soap and do like this, and these you take the soap and you are applying like ferociously that these get burst. No, you take bath gently with simple, normal water, not hot, not cold, but just simple, normal temperature water, and that's enough. It will help you to maintain hygiene as well as you feel refreshed. But remember, don't try to burst these vesicles. You cannot pop it out while bathing, or you cannot pop it out through, just sitting there and popping out these vesicles. No, it will again spread and it might create secondary infection, bacterial infection. Now, third myth related with chickenpox is that it is said that it is very infectious at the time of scabs, when it is drying up, these rashes are drying up, that is the time period where it is infectious. The answer is no, it is complete myth. The infectious period of chickenpox is from 2 days before the rashes appear till these scabs are formed. Mind you, these they comes in crops, so in one time only you can see vesicles, you can see rashes, you can see scabs. So if all the rashes they dry up, that period you will not be infectious at all. Actually, what happened is at that time only the second person in the home or house will be showing symptoms of chickenpox. So we think that people think that yes, at that time when the scabs are formed and they are drying off, that is the period the other person is infected. But the answer is no, because the incubation period is 2 weeks. Mind you, I told you in the starting of the video that incubation period is 2 weeks, so that the other person is has got the infection 2 weeks before, and then ultimately showing now when this the first person is almost going all right by drying these scales. So that is the third myth surrounding with chickenpox. Now let us see what are the homeopathic medicine. Now, well, as I said, always says that home in homeopathy we see the sign and symptom of the person, and accordingly we give the medicine. Now the preventive medicine जो normally we use is variolinum 200. Variolinum is a really very good medicine for preventive measure. If the person in a household, one person is infected, the other has not taken injections, or others they never had chicken pox, so for them we can give variolinum 200. Variolinum 30 can be given to the person who is infected enough, so that can also be given. Second medicine is rustox. Rustox is really very good medicine for chicken pox whenever rashes are there and in climatic change is there. Rustox can be given, and where there is physical irritability, physical restlessness in the person, rustox can be given. Third medicine which can be utilized in early stages of chickenpox, wherever their fever is there, come with the fever, and we know that in his or her household one person is having chickenpox, and because of the fear, this person is he's completely out of fear, he was completely afraid, and from there, and he is having fever, he's very thirsty, he wants to drink a lot of water. So there, in these cases, we can give econite. Belladonna is the next medicine which can also be given in conditions wherever there is fever, wherever there is rashes and reddish color, warmth is there, belladonna can be prescribed. Last medicine, not last, but last of this discussion, is antim crude. Antim crude can also be given in conditions wherever there is chicken pox and where there is gastric derangements are also there. So gastric derangement, and if you see the tongue of the person, it is whitish coated, then you can give antim crude. Well, friends, let me just conclude that chickenpox is something very infectious condition in the community. Even today, it is prevalent, especially in seasonal variations we see. Signs and symptoms I have explained, its complications are also there. So please restrain from hearing all the myths and everything. Please understand what this condition is. Well, saying this, let me say, if you like my video, if you think that it is informative enough, please like, please subscribe, comment and share with your friends. Till then, goodbye and thank you from me.